Welcome back, everybody. Let's move on to our invited talk from Dr. Maggie Mulqueen, who, of course, I'm biased because of my own work in clinical care, but we'll make accommodations for my bias. Our most important talk for the day is in support of our theme, people talking to people with civility, courtesy, tolerance, and respect. How do we get people just to be nice to each other and say hello to their neighbor? So I hope Maggie, you have some good words for us to help us move in the right direction.
Well, thanks,
So
Carl.
please.
Okay, thank you. So I want to start my remarks today by asking each of you to take a minute and ask yourself two questions. First, who in your life do you feel listens to you the best? And the second question is, who do you listen to the best in your life? So for my talk today, I'm going to focus on one component of care. And this component is often overlooked in our culture, and it's the power of listening. Listening to each other and to ourselves. Let me begin with a discussion of what makes it hard for people to listen to each other. And from that, I will discuss what we can do to enhance our ability to listen. And then I want to take some time to discuss the context of trying to listen with a world of social media and texting. And I will end with some thoughts about how we can listen to ourselves. So, first of all, being able to listen is hard when you live in a culture which emphasizes talking and winning. In Frank Bruni's recent book, The Age of Grievance, he discusses how we shut out opposing points of view when we feel aggrieved and end up living in echo chambers. We filter information for agreement. Increasingly, we live in a world that does not value facts, and expressions of feelings are often pronounced as protected speech. To question someone's feelings or views can be a dangerous thing in this fraught atmosphere. And the situation on many college campuses right now is an illustration of how complex the situation is, with administrators and presidents being removed from office and students being arrested and not allowed to graduate. Living in a world with cancel culture has a chilling effect on many of us in prominent positions where bad reviews or worse can derail a career. I've written about the impact of cancel culture on therapy. I'm a psychologist, and I know there are many of us who are concerned about what this cultural phenomenon does, not just to ourselves professionally and personally, but also what it means for our children. It can be hard to listen to someone if they are spewing lies and vitriol. It also rarely feels productive because the ground rules for good communication are ignored or worse, violated. Being the loudest or the most righteous person in the room doesn't equate to being heard. Furthermore, if we remain silent in the face of such hate, we worry that our silence will be interpreted as agreement. And this can lead to the no-win position of either joining the argument or leaving the conversation. Neither position is usually rewarding, and so we limit ourselves to whom we're willing to talk to and whom we're willing to listen to. But given that we know that human connection is essential to mental and physical well-being, we need to learn how to reach across this divide. What does it take to breach the gap between speaking and feeling heard? If what we want is to care for another person, what are the essential components of effective listening? First, I would say there needs to be genuine interest in hearing what the person has to say. We've all had the experience of speaking to someone who is just biding their time until they get to speak. And Deborah Tannen's work on psycholinguistics does an excellent job of outlining how various speech patterns and norms set people up to have or not have effective communication. One of the most impactful things someone ever said to me when I was trying to explain a difficult and painful experience was, "Maggie, I don't need the Cliff Note version." This intervention gave me permission to take my time and explain myself. I relaxed, knowing that the listener cared about me before he even knew what I was going to say. It is a line I've used many times to good effect when I am trying to convey to someone that I care about them and want to hear what they say. How we communicate our care, most importantly, is by being trustworthy. If it's confidential material being shared, are we prepared to keep confidentiality? For example, I'm a psychologist. That makes me a mandated reporter. And if someone threatens to self-harm or harm to others, I need to, legally, I'm bound to tell someone about that. So I educate my patients about these legal obligations before I invite people to share with me, not after the fact. If there are limits to our ability to listen, we must outline those at the beginning, be it time constraints or topics or ways of speaking that impede our willingness or capacity to listen. We should set the boundaries from the start. For example, I'm always careful to suss out how comfortable my patients are or are not with profanity before I swear in a session. Also, I have a pet peeve about adult females being referred to as girls, and I share that. Not so much to be too corrective, but because hearing that use impacts my ability to listen to the person. I get annoyed when adult women are referred to as girls. And the person who I'm trying to listen to may sense my distance and not understand why I'm distancing from them. But if I make myself vulnerable and take the time and say, you know what, I just struggle when adult women are referred to as girls, then they can make a decision for themselves about whether to continue that pattern, but not have to internalize that I'm rejecting them and everything they're saying. Those two examples are examples of why there's so much risk in actually trying to listen to each other and what it takes to be honest. Creating the space to listen, being present for another person, does not mean denying our own needs or state of being. Whether it's a therapy session or a casual conversation with a friend, it's very important to acknowledge whatever constraints we might have to engage in the conversation, such as a time limit. I used to train resident advisors in colleges, and they all wanted to have this great open door policy so that the freshmen on their floor would feel welcome and supported, and they thought that was a good way to do their job. But often by mid-semester, they were closing their doors on the students because their own work was suffering. When that happens, closing the door after the fact, it's actually very hurtful. So a lot of our work in the trainings was helping the students, the RAs, from the beginning to understand why setting limits was a positive, and that in fact they would have a better experience and their freshmen would have a better experience if they were honest from the beginning about how, when, where they could be available. Teaching these students and teaching other people how to have appropriate limits enhances our ability to listen. It doesn't limit our ability to listen. Another example of how this can be challenging is when you have adolescent kids in your life, either as patients or as your own kids or whatever, who often come awake just as we want to go to sleep. I know when when my own children were in high school, I would set a time limit of 10 p.m. for conversation, because after that I was toast and it wasn't an effective time, even though they were now waking up. Similarly, I agreed to their request that in the mornings before I left for work, I didn't talk and give them the whole litany of what I wanted done in the day, but I would write it down. And then they could read my instructions when they woke up. Finding those ways to negotiate and communicate set the stage for much more effective conversations. It's also really important that we not confuse listening with agreement. Too often, what people want from a listener goes beyond understanding to acceptance or agreement. With that as the implied expectation, it's no wonder we find ourselves in echo chambers, because we only want to listen to people who are going to agree with us. So you have to ask, am I asking to be heard, or am I asking to be agreed with? And that's a question we need to be honest with ourselves about, both as the speaker and as the listener. In Mistakes Were Made, But Not by Me, Tavis and Aronson discuss the significant impact of people doubling down on what they believe in rather than listening to contrary facts. They have unbelievably chilling examples in the judicial system, the police force, etc., about cases where people would not change their opinion and only in fact got stronger in their opinion despite all the contradictory evidence that was coming. And they discuss how people move to more extreme positions when they are challenged rather than being open to new information. So for example, if I go to the movies with a friend and we come out of the movie and I say, "What'd you think?" And she says, "Wasn't for me." And she says, "What did you think?" And I say, "Oh, I actually liked it." We then go out for coffee and have a conversation about the movie. Chances are by the end of the coffee, she will feel more strongly she didn't like the movie, and I will feel more strongly that I liked the movie, because we will have had to assert the supportive reasons for our initial response. That's how people move apart rather than together. So by being genuine and open, we can listen to another person and try to understand their feelings or their position, but that does not mean we are bound to agree with them. Listening is also not problem solving. Too often, to show we care, we think we need to do something. Often that leads us to the opposite effect. Rather than feeling heard, we feel patronized or worse. When I've had a bad day, the last thing I want from my husband is for him to tell me how I could have done better. In time, I might look for suggestions, but initially, I just want to feel heard and comforted. Comforting someone is actually doing something and usually brings you closer, whereas problem solving sets up a power dynamic of one person being seen as smarter than the other. There are ways to reduce the burden on others. For example, when someone is grieving, I don't expect them to initiate the first contact. I might offer to bring a meal, or I send a card, or I make myself available to take a walk. By offering my presence, I hope to ease their burden, not solve their problem. When we draw close to one another and feel listened to, when we feel heard, the relationship is usually strengthened and deepened. With this closeness comes connection. Going back to my initial questions at the beginning of this talk, I wonder how many of you name the same person as the one you listen best to and the one who listens to you best. It's not always the case, but oftentimes we build a shared language and shared experiences which enhance our ability and willingness to listen to another person. Consistency in showing up for another builds the progression towards closeness. This is why we long for a physician who knows us, not just one who can read the MRI correctly. It is also why my long-term patients value our relationship so deeply, because I know who they are talking about and can remind them of things from their past that are having an impact today. Ironically, earlier today, I had a session with somebody who I've known for 20 years. I haven't seen her consistently for the 20 years, but on and off. And she started our session today by saying that she'd spoken to an old friend of hers and said, oh, and when she said, I have to go, I have therapy, she said, are you still seeing that same woman from so many? And she hasn't solved all your problems yet. And my client advocated for why the depth and history of our relationship has actually been so incredibly meaningful to her, rather than framing it as, oh my God, she must be so sick that she's still seeing the same therapist all these years later. Before I switch gears and talk about how to listen across texting and social media, I want to emphasize two truisms in psychology. The first is anxious people can't listen. The second is enraged people can't listen. Therefore, before any listening can happen, the emotional state of the person needs to be attended to. Failing to do so leads to a failure to communicate. Once the doctor tells you that you have cancer, the rest of the conversation is meaningless until the emotional impact has been addressed. Also, if you've ever been in the presence of a 2-year-old having a tantrum, you know full well how meaningless your words are in that moment. In order to break the spell, it's the tone in your voice, it's your physical presence that can help calm the child. It's not the talking that goes on. So what about the impact of communication when it's not face-to-face? When we try to communicate through text and social media. I've written on this topic before, and first of all, it's very, very difficult to listen well when you don't have body language and tone of voice. Disembodied communication, to say nothing of anonymous communication, lends itself to taking extreme positions because there are few to no natural guardrails. Therefore, it is rife for misunderstanding and hurt feelings. It is also much less clear how to end these conversations. One of the things that people find very difficult in emails or text messages is the thank you, back and forth, and no one kind of really knows how to bring the conversation, if you want to call it a conversation, to a close. There's also, of course, the pressure to respond immediately and succinctly, which also alters how we listen to another. The use of all the abbreviations and the use of emojis is a very poor substitute for the sound of someone's laugh or the ache in someone's voice. For myself, when I moved during the pandemic to doing therapy on Zoom, which was completely out of my experience prior to the pandemic, some of my patients did not want the visuals for a variety of reasons. And so then we lost the visual as well as the in-person experience. And so what I found myself doing was requesting with people that once a month they would do a visual, because I didn't want to lose track so completely for what the presence of their life and themselves was like. And most, not everybody, but most people accommodated me on that request. And if people are interested in the Q&A, we can talk about what we see as the positives and the flaws in working remotely. But setting expectations, be it about texting or social media, is really important for how we're going to listen in those milieus as well. It's very important to believe that we don't actually always have to have our cell phones on or be connected in some way, and also that we can take more than a second to respond to people. We have a responsibility and a role in the expectations we create in others about how available we are to listen. And that, I think, is something I know with my own children who are now grown adults. They never listen to a voicemail. They think it's ridiculous that I bother to leave them. They know that I've called, they've missed the call, and they just call me back. I, in turn, get frustrated. I feel like I already asked my question in the voicemail if you just listen to it, but now I have to repeat myself. So part of this is learning across generational lines, across different kinds of experiences with people. What are the norms that are being set up for effective communication, and how and when both you and the person you're trying to listen to can come to some agreement about how you will actually create an environment that enhances your communication. So this leads me to my final topic, which is the importance of listening to ourselves. Now, if you're anything like me, when you hear the term self-care, you roll your eyes and think, nice concept. Who has the time? Unfortunately, the prevailing model in our culture is to conceptualize care as an either or. Either I can take care of myself or I can take care of others. And for those of us in the helping profession, this dichotomy is especially harmful. There's burnout, there's depression, there's substance abuse. Because the concern of the self-sacrifice is that it is lauded as best practice. And if you are not always available and taking care of people to the nth degree, you question your own, or are questioned about your own level of care. But if we don't listen to ourselves, we limit how well we can listen to others. It needs to be a both and. I listen to myself because I value myself and my needs. I try to only offer what I can give without resentment. How well I can listen to myself is an indicator of my own ability to take care of my needs. Listening to myself might involve asking others for help. One way to help ourselves listen to ourselves is to take time. I never agree to something when initially asked. I always ask for some time to think it over. I never say yes immediately. And this allows me to decide if my desire to do something or not do something is based on my own true feelings. Is it my knee-jerk reaction to say yes because I'm flattered that somebody asked me to do something? Or is it really something I have the time, space, and want to do? Similarly, am I saying no because I'm afraid? And maybe this time I actually want to say yes and challenge myself beyond the no, but I need some time to think that over and make a reasonable decision. It's ironic, I just returned from my first ever trip to Africa 2 weeks ago. And that was the thing that an example of something that when I was initially asked if I wanted to go, if I had responded with my initial response, it would have been no, because I don't like flying very much. And it was the longest flight I've been on and the most little planes. We were on 10 planes in 14 days. So it was a real stretch for me. But when I gave myself time to think about it, to ask myself if I could challenge myself, what I could put in place in order to feel comfortable to have the end result of having experienced a trip to Africa, I decided to say yes. And that's why I think listening to ourselves involves taking that pause and taking that time to go a little deeper and say, do I really want to do this? Do I really want to agree to this? Now, there are gender and racial components to what I am discussing. Our expectations regarding who listens and who talks are steeped in cultural norms that are unhealthy and discriminatory. And we need a lot more research to look at how our patterns of listening and talking are impacting mental health and physical well-being across socioeconomic status, across race, and across gender. While doing my own research on competence and sexual identity, I was surprised to discover the significant impact that participation in my study had on the lives of my subjects. The very act of being interviewed at critical points in their professional development changed the trajectory of the women's experience. It's a serendipitous finding. And there's work done by Robert White and Daniel Levinson and others which have shown the similar kind of impact on men who've also had the experience of being interviewed. In other words, the interview questions themselves, the results of the interviews were not what was impactful. It was that they were selected in some fashion by someone and chosen as someone important to listen to that changed a significant experience in these people's lives. And I think that alone is something that's really worth paying attention to. And we have a very bad track record in the psychology world of who we have decided was important to listen to in our research. So I say that as a disclaimer. But my learning about that and experiencing that during my doctoral work really informed and changed how I became the kind of therapist that I became. So, being a good listener aligns with my values. It's something I strive for on a daily basis, both personally and professionally. And it's hard work at times. It takes effort and it takes patience. And I was not genetically born with a lot of patience. But I've been rewarded by the impact I've had on others. And when I receive the understanding and knowledge that I am truly known and cared about by those willing to listen to me. Now, to outsiders, it might look like I'm not doing much. But I know from experience that the quality of my relationships is the deepest joy and accomplishment of my life. So, to practice what I preach, I wanted to end here and listen to your thoughts and feelings about the concept of listening. Thank you.
Oh, wow. Thank you so much, Maggie. I could ask a ton of questions, but then again, I'm a professional clinical psychiatrist who's done mostly emergency care and emergency services. So I will just remark that probably two observations from my experience. I personally believe that disregarding the mistakes that I made as a newbie, a beginner in the 1980s, 4 decades ago, The number one reason that I've stayed safe and injury-free in all my years of work in emergency psychiatry is because I listen to my patients. And
Mhm.
so I'd like to truly emphasize this critical point about listening. Um, if the patient in the ER believes that I care and believes that I'm listening, I'm not going to get punched in the face.
Mhm.
So that's one key point. The other key point that I'd like to underscore that you made was this notion of presence. And I've, throughout my career, have been able to uh, help persons uh, deeply troubled, difficult to reach in acute involuntary care simply by being there, just sharing my presence.
Mhm.
And that can be done either just by sitting with them. um, I've also found that it's extremely helpful if they're willing to get up and walk the halls with me. we just walk the halls shoulder by shoulder, side by side. Don't have to say a word. I just walk the halls with them. And so it's not even a question of listening or hearing. It's actually just a question of being my
Mhm.
presence with the patient, sharing my presence. So I wanted to underscore those 2 points. You made both those points. And from the perspective of an emergency psychiatrist, it makes um, all the world of difference, just in terms of my own physical safety in the ER, as well as successfully connecting and relating and helping patients in the hospital. So, with that, let me open it up to other questions, comments.
Okay. Well, so one thing you said sort of caught my interest the that selecting these individuals to talk to in your study actually influence the outcome, so to speak. Is could you is it saying a bit taking that the metaphor a bit too far to think that there's a kind of quantum uncertainty principle for human beings? Like certain questions you can ask, like the more you ask about certain questions end up closing off other avenues of questioning, and while sort of backing off from some lines of questioning open up others.
I think I understand your question, but could you give me an example?
um yeah, sorry, this is just something that came to mind because of what you said, so
Yeah,
it's
no, I appreciate
maybe
that.
not very well developed, sorry, but like suppose, sorry, if someone else has a question while I come up
Well,
with a good,
maybe
better
maybe it
example.
would help you to give if to clarify this if I gave you the context for my study and the context for the other study.
Sure.
So, for example, the women in my research, and this was research I started as that was the basis for my doctoral dissertation, then went on to be the basis for the book that I wrote about this topic of sexual identity and competence. And so when I was looking for my subjects, I called various academic departments and asked the department chairs to if they'd be willing to give me the name of the most competent female graduate student in their department. So when these women, my subjects, learned that they had been selected for that, and then they all agreed. So I didn't have the problem of some people agreeing and some people not. And everybody who was selected for me agreed to participate in the study. Um, then I had, my list of questionnaires, and I interviewed them over a period of time. And then when I was doing the book, I went back and interviewed them 10 years later. And one of the women articulated it so well when she said, it was the fact that at that critical juncture in my life as a graduate student, somebody thought, meaning me, that I thought she had something worthwhile to say. And I was willing to spend hours listening to her, recording, transcribing our sessions, changed her opinion of herself. So separate from the questions I was asking, the information I was gathering, the theory that I developed, it was that experience that I spent that kind of time and said, what you have to say to me, and I didn't know what she was going to say, was worthwhile. In Robert White's work, he interviewed Harvard undergraduates over many, many years in his career. And one of, again, the serendipitous findings they found is those students who were randomly selected to have this to come into the counseling center and be interviewed once a year, at the end of their freshman, sophomore, junior, and senior year, they all had a much more positive view of Harvard than the typical Harvard student because they thought somebody on this campus actually cares about what I have to say. And so I think, we can call it feeling known, we can call it being, seen, heard, whatever. But that sense of, investment in a young child, even in adults, makes a huge difference, I think, separate from whatever the content of what the conversation is. Does that help answer the question you
Well,
have?
yeah, there's that, the though following up on that, then the way it's still the case that the way you were introduced to each of these participants was through your department, through their university department, through their advisor. And
Yep.
so in some sense, you were still engaging with them as sort of professional in their professional lives.
Right.
And so I suppose here what I'm thinking is, do you think that led to both different answers that you got from them and a different impact on how this interview process influenced them than if you had sort of selected people based on the other side your of your of the research, the sexual identity side?
Hmm. Yeah, perhaps. I mean, my level of questions was a whole developmental interview because what I was really curious about when I started the work was what had happened developmentally that enabled these women to be PhD students at that period of time when women in graduate school was not common, um, across discipline, even in what are now female dominated disciplines. But at the time, there wasn't a female dominated PhD program. And um, so I think in the end, we got to all of that kind of conversation and information. But certainly, I think the fact that, although, one of the subjects who was in the what we traditionally call the hard sciences said, well, my chair didn't have a choice because there are only two women in the department and I'm the only one who's a native English speaker. So she completely dismissed the value of her selection, by saying, it's not that I'm so great, it's that he didn't have anybody else to choose. But I think if I understand your question, I think your point is well taken that however our entry point is with a person, that at least initially sets the groundwork for where the conversation will go and what kind of connection we'll have. I mean, I would say from kind of on the other side of that, there are many people who've been patients of mine who, if I'd met them in a different context, we might have been very good friends. But we're not going to be friends now because we met in a professional relationship. And so it doesn't limit what we talk about, but it limits the nature of the relationship in some significant ways.
Okay, fair enough. I think get the idea. Though, I also like to point out as a follow-up to Dr. Tazwell's comment that walking, meditation in Eastern cultures, and the peripatetic school of philosophy in ancient Greece, and basically, and what was it? What's it called? Walkabout in Aboriginal Australian culture, and a number of other walking related ways of sort of, well, what you had called self-care, but from a psychological standpoint, figure into a lot of cultures.
Yes, thank you for that. Thank you. Um, as a fan of Australia, I always love the mention of walkabout. So yeah, it's I personally believe it's for real.
Well,
Um,
I think that raises, for me, also the question. I don't know, since I don't know what each of you does for work. I mean, it raises this question about what is the effectiveness of remote work with people, because I certainly have strong feelings about it for myself as a psychologist, lost and what's gained in terms of the physical presence, where the ways that I could show listening were very different when I was in person with people than remotely, because you hear the change in someone's breathing and you sense someone's change in their body language, and that communicates listening in a very different way than I feel like working on Zoom does.
well,
Hi.
I can certainly, yeah, Josh wants to ask a question, but let me just respond to that very briefly.
After you finish.
Josh, if you're going to have to turn your microphone on to ask your question, but
Yeah, I want you to finish what you're saying first, and I'll finish what
yeah,
you want to say.
yeah.
Yeah,
So I've been involved in telecare of various kinds for at least 3 decades now. Telecare with just telephone, telecare with video. We've done. Um, I've I've done mostly emergency psychiatry, forensic psychiatry, geriatric psychiatry. I mean, telecare, televideo is critically important to reaching elderly in their homes. Telecare is an absolute necessity when working in the state prisons if you're going to reach all the various state prisons. But regardless of necessity, when imposed, I will not hesitate one nanosecond to say that I would rather interview and interact and meet with and talk with and observe a patient in person. There is no doubt that the in-person presence interaction is far superior. There is no way to observe physical side effects of various medications. There's no way to observe patients' head movements, facial expressions, body language if you don't have at least some kind of video. So video chat or video conference is always superior to telephone only. I mean, I could go through this hierarchy, but the key concept to this hierarchy is absolutely in person, in presence is always superior. And then video will be superior to audio only, and obviously audio only is still superior to text only. So there's definitely a hierarchy there, and I will always opt for in person, in presence, because that's really the only way to know your patient and help care for your patient. So, Josh, you had a question.
Yeah, I had a question. You began by actually alluding to universities, which I'll be honest, that made me nervous about the talk I'm going to give. I'm a professor at the University of Michigan, and my kind of hypothesis or my experience has been the people in the high, because you talk about professors, university presidents being removed. My experience has been about people in top positions of power creating environments where there's not a lot of opportunity to be listened to if you don't say what they want to hear.
Mhm.
And that was, and I guess I'm curious if so, and I'm actually equating that not listening to really bad things that have happened, from mass sexual assaults, anti-Semitism, racism, and other things. That's what my talk is kind of going to be about, and it's going to be a little bit of my story of really trying. The way I was always raised, the polite way, is raise your hand, ask a question, write a nice email to someone, try to talk, and seeing none of that working, and seeing me not being listened to, and wondering what the heck I do. When I finally realized I've been there for 11 years, realizing what the heck do I do when there's these really important things happening, like at our particular campus, the largest mass sexual assault in U.S. history, and the people who've been through it not getting listened to, and what do you do then? So I'm just wondering if you have any any thoughts about, but that was my feeling, is actually people in power creating places where listening isn't happening.
Yeah, I think I used to I had academic appointments throughout my career, and I feel very grateful that I don't anymore right now because of this environment.
That's the advice you
Um,
gave me. Thank you.
yeah, no, I mean, and because I in the Boston area, a lot of people in my practice are either faculty members or are related in some way to higher ed. I mean, that's the backbone of Boston, or students, and it's very fraught, I would say. I mean, and I think um, that there is the cliche, money talks, right? And the powers that I didn't talk about in my talk are, I just alluded to the race and class and stuff a little bit, but is who gets to have the microphone and who gets to be listened to. And that is, it's just like the question about one person, one vote. It's not that all people's voices are equally valued or promoted. And so I frankly don't think there's much listening going on. And I think that's really the complicates the problem, is that people are so worried about getting their own position out there that they don't feel like they have the time, the interest, the energy, or the faith anymore that anybody will listen well. And so the the silos that have developed are extremely troubling to me. And you know, I'm fortunate enough that I'm far enough along in my career that I don't want to tempt the gods here, but a bad review is not going to stop people referring to me or something like that. But there are, if I was a young therapist starting out, um, I'm not sure, just like, a pre-tenured professor feeling like, am I giving certain grades? Am I teaching for those reviews at the end of the semester because I need this job and I want, how much do those forces also operate that really restrict our capacity to feel like we can be honest and open and vulnerable and make mistakes? And then also, if our mistakes are recorded and come back to haunt us, you know, can you just be a jerk when you were 13 and not pay for that for the rest of your life? I mean, how do we help people grow up if they're so afraid that this will haunt them forever? So I think all of those things um, have deteriorated conversation in general. And, you know, I certainly just think it's an incredibly fraught and difficult and sometimes bordering on dangerous time for people to feel like they can really, beyond their own personal echo chamber. I mean, I can't tell you how many patients I have who first ask permission. They say, nobody can hear me, right? Because they want to say something that's not politically correct, or they want to express something and they're so afraid of retaliation. And, we're in a therapy situation where, you know, and they're still they reverberate from being in the outside world. It takes time for me to calm them down and say, I promise you, no one's going to hear you. I'm not going to repeat this. please, I want to know what your genuine feelings are and to try to help them feel safe.
And it sounds like you have a good disclosure that you practiced over many, the sort of the Tower of Full
Yeah.
disclosure. But I have to disclose these couple of things. Other than that, everything you tell me is
Well, and,
confidential.
and, and I must say,
They still don't get it right away. They're still not used to it. They're so used to being
no,
recorded.
exactly. But when I started writing and publishing on international national platforms, so I write for CNN Opinion, I write for NBC News Think, and the Chicago Tribune and other places. The vitriol in I wrote a lot during COVID, and the vitriol in the comments that I would get back was frightening. And, I mean, to the point of, comments about my kids, my family. No, there were never, thank God, any threats to my personal safety or that of my family, but so disgusting. People who know nothing about me just read a little article and I thought, wow, that prompted you to 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 spend your time writing all this. And it only gave me deeper compassion for people who are truly public figures. I cannot imagine what it must be like in this day and age to feel that if you say something, what can come back at you is so horrific and dangerous.
We have a couple of questions from some of our other participants. Let me start with Natalie and then go to Flip.
Hi,
Lots of good questions here.
good afternoon, everyone. I wanted to offer this. I think to some degree we do have to recognize that we organize ourselves into silos for really good reasons, but we do need to figure out what it means to create porosity of silos. And so to create porosity of silos, one of the things that we've been leveraging as we work, particularly in health systems and often with the nursing workforce, is giving them real understanding of high and low context communication styles and the implications of that, particularly in a healthcare setting. So, one of the things that we know, for instance, is that very ill patients are very high context communicators, but their clinicians, particularly because they are very ill, tend to be very low context communicators. We also know that high and low context communication plays a significant role in how women communicate versus how men communicate, how their leadership is perceived, men versus women. How
Natalie, can I ask you to clarify
Yeah.
what your meaning and interpretation of your phrases high context and low context are?
Okay, so high and low context cultures come from the field of anthropology. The United States would be considered probably the lowest context culture on earth. And you would be looking at Korea and Japan, for instance, as being the highest context cultures on earth. And from that, there are communication styles that exist. Low context communicators are very direct, they're very factual. They tend to be rather transactional in the way that they share information. They need to receive information in ways that are very direct, somewhat linear, uh, and conversely, people who are high context communicators, they want the context. So you can bury the lead with them. They are going to speak in a way where they're going to give you all of the context before they get to the point. They're more focused on the relationship as opposed to the transaction often. And so what we're finding is, and I did a retreat for about 300 nursing leaders, teaching them about high and low context communication was a huge aha for them, because you'll find racial differences with regard to high and low context communication. And so African Americans traditionally and culturally are higher context communicators. And as a result, in workplace settings or in a host of other places, they may not be taken seriously. They may be seen as not having the facts, when in fact, if you listen deeply and with the intent to understand as opposed to wanting to respond, you can actually have a great communication with them. On the flip side, people who are very low context communicators are often seen as being less empathetic, when in fact they may be very empathetic. It's just that their communication style does not allow people to understand that about them. So, excuse me, for us in a healthcare setting, teaching low and high context communication styles, approaches, and cultures has been helpful to these nursing leaders and nurses to reconsider how they are communicating with patients and actually how they're communicating with one another. It's starting to break down some of the barriers. And the thing that I often say is you don't go to Greece, tell a joke in Italian, and wonder why no one laughs. You have to be able to communicate with your audience in the way that works for them. So, as I was listening, Maggie, to you talk, this thing around high and low context communication, particularly in environments that are whether there's a lot of vitriol going on or it's just a highly stressful environment, if we understand who we are as communicators and we can understand what our audience needs, we can make adjustments to how we listen as well as how we speak and be more effectful and impactful as we communicate. That was what came to mind for me as we were listening to you.
Can I quickly get Flip's comment or question, and maybe we go 5 minutes over, and because there's some big issues here. Flip, you had a comment question.
Just a couple of brief ones, and I'd be cannibalizing my own time here, Carl, so I'm okay with that. Okay?
Well, I I mean, these are big concerns with big questions.
Yeah,
So they're not easy. They're not trivial.
and I don't want to trivialize these with what I'm about to say, so please
Yeah, go ahead,
be
please,
gentle.
please.
But one of the wisest things that I was ever told, I was told in business school by a man who, frankly, had some communication issues of his own. But he basically said that we ought, all of us, to emulate the elephant and not the crocodile. Be mostly ears and not mostly mouth. And I use that repeatedly, and most people get the image quickly. So
Yeah.
that doesn't guarantee that you're actually listening, but it does guarantee that you're trying to.
Yeah,
Uh,
absolutely.
the other thing, and this is not a critique, and I'm shifting gears and directions here, but Carl knows that I lived in Australia for years, and the walkabout has a very solitary component to it. In most cases, it's not something you do with somebody else; it's something you do on your own to clear your head. And depending upon the teller of the report that somebody is on walkabout, it either means that they're doing something deep and meaningful for them personally, or they're effing off. Those are the two meanings in Australia for the same term. So just be, speaking of context, aware of this element of context also.
Well, thank you for that clarification of Aboriginal Australian terminology. I must say that my walkabouts with patients in hospitals are typically with paranoid schizophrenics who do not speak a single word, and I don't speak a single word, and we just walk together, not saying a single word. So it's just a different kind of walkabout, I guess. That's silent without speaking, but nevertheless movement. And I think the key to the walkabout that I was emphasizing was, quite frankly, the movement. And I do think that sharing presence, while also in the presence of movement, even if it's just simple walking, um, it's like a journey. It's walking a path on a journey, and even if it's just around the halls of the hospital, let me tell you, it makes all the world of difference to some of my patients that I've been able to connect with, even though we didn't say a word. So that's my Americanized version of walkabout. All right, let's Natalie, we will get back to more discussion of your comments for your talk, but let's take a 2-3 minute break, and we'll reconnect in just a couple of minutes. Okay. All right. Thank you, everybody.